Hi, everybody. Welcome to the presentation of integrative medicine for the 2023 World Qigong Congress and for the 50-year celebration of Dr. Alex Feng and Jidao Guan. Thank you for letting me be part of this. I'm very honored. And I wanted to do this because I want to honor the animals for their role in integrative medicine and upholding Qigong around the world and around the planet. So I've been a holistic veterinarian since 1979. And I've been in practice for 45 years. I was one of the original members of the American Veterinary Holistic Medical Association. And when we first started, there were maybe 50 participants. These days, there are thousands of veterinarians around the world who are practicing acupuncture, acupressure, herbal medicine, homeopathy, energy field work, and nutrition, and a lot of different integrative therapies. And I'm very happy to say that we are being more noticed and included in the veterinary profession. Yay! So this is a presentation to share some of my patient stories with you and to honor the animals in their role in the world today. When the COVID pandemic started and we were not able to see patients in person all that much, and certainly the humans had to stay out in the car while their animals were brought into the clinic, I started to do online consults with my clients and patients. And I used my experience and my ability to visualize the meridians on the animals, the energy fields from working with the animals all this time, and to establish connections with the animals and their humans on the computer. And it evolved over a period of time, not only through the actual pandemic, but now this post-pandemic, if you can call it that, as we're re-emerging into a changed consciousness of the world. And the animals are playing a wonderful role. They helped us through difficult times when sometimes they were our only companions. And they helped to share love and connection between us and around us. So here's some of their stories. I'm going to share the screen here. Great. So this is Mr. Morris. And Mr. Morris is about 7 years old. He has a history of chronic nasal obstruction. He was on the street and in the backyard of my now client, who is also an acupressure student. And she took Mr. Morris in a couple of years ago. And he's always had terrible breathing and not being able to breathe. He had been on antibiotics for several years, and they're no longer being efficient. So she contacted me to see what else we could do. And the first thing we recommended was vaporizing. And here's the bathroom with the vaporizer, the steam coming up in the bathroom. And here's Mr. Morris laying on a pad near the vaporizer, accepting the steam. So he has several sessions of steam a day, and we did this for several months until he didn't want them anymore and didn't need them. It helped to open up the nasal passages. We used a couple of drops of essential oil. Cats are very sensitive to essential oils. And we used lavender and helichrysum. And Mr. Morris loved the sessions. This is Mr. Morris before an acupressure session. And what I wanted to show you was his hair sticking out on both sides. And this is known as the erectopili muscles, hard to say, where the skin surface gets muscle spasms and the hair sticks out. So it shows stagnation and spasms in that area, which is right behind the diaphragm. This is Mr. Morris after the acupressure session that was done online or in person with his human, and see how the hair lays down. This is Miss Patty Pat. Miss Patty Pat is 13 years old. I think she's a total beauty. And she has chronic digestive issues. She was diagnosed with inflammatory bowel syndrome, and she has either erratic appetite or vomiting of bile or phlegm, or she has issues with the stool where it's too loose and it sputters and spatters all over, or she can have terrible constipation. So Miss Patty Pat loves the energy work online, and I connect with her through the ether of the airwaves, and we just do sending of points and moving the energy. This is a quote from my client saying right after the telehealth session, Miss Patty Pat had the firmest bowel movement of the week, and even after eating wet food. And then she zipped around and played with gusto. She loves her energy sessions. This is Cubby and Maureen. Maureen's the person. And Cubby has been my patient for a very long time, since she was a puppy. She's now over 10 years old. And she was having surgery to remove a tumor from her side, a mast cell tumor behind her front legs on her rib cage. And I set up a session with Cubby before the surgery to help calm the energy field and support her for the anesthetic and the surgery. This is Maureen talking after, excuse me, after the surgery, when she brought Cubby in.
We had to go in for a mast cell tumor surgery, and I saw Cheryl ahead of time for a video telehealth appointment. And I don't know how this works, but Cubby sat through it. I touched her. Cheryl told me what to do and felt what was going on with her. And after it was over, Cubby slept soundly, just like after an acupuncture appointment. And when she woke up, she was so frisky and feeling good. I don't know how it works, but it works. Thanks.
This is Mr. Watson. I keep switching where my face is here. Mr. Watson is 7 years old, and he has a history of being attacked by a coyote outside that damaged his front left leg. My client took him from a neighbor where the cat was not happy, and he did want to move in with my client. And my client dealt with the bite wounds on the front left leg that were healed, but he didn't have much use of that front leg. A couple of years later, Mr. Watson developed hind leg paralysis. This is a situation that was diagnosed as what they call a saddle thrombus, which means there's a blood clot at the ends of the aorta, creating paralysis to the hind legs. Usually the cats either succumb at that point, or they're treated with high levels of prednisone. The clot moves away, but they don't have use of the hind legs. My patient was very lucky. He started to recover. My client took him home and started working with a colleague of mine who does energy work called psychomotor technique that works with the muscle chains and the various energy fields that include emotions and history of trauma. He was able to get Watson to a certain place, and then he asked for my assistance to be part of the team. So here I am with Watson doing Qigong energy acupressure. And I'm happy to say that after working with him, now it's gone over a year, Mr. Watson not only is having great use of his hind legs, but he's also using the front leg. So it's not totally normal, but he's using the front paw to push off, and he can get up and down the stairs and around the house, and he even bullies the other cat in the house. So thank you, colleague. Thank you, Watson. Thank you, client. We're just going to move this around right here. And this is Cody. Cody is 13 right here, and Cody has skin issues. Cody's been my patient for a really long time. And just starting with COVID, we started seeing him online. Now, in most holistic medicine, including Chinese medicine, we believe that the skin and the intestines are like inside out from each other. So they're totally connected. And with food sensitivities and allergies to food, you get skin issues. So the heat on the inside comes to the heat in the skin. And we've been working with Cody with digestive issues using something called NutriScan, which tests for food sensitivities so that we know the best diets. We work with acupressure. My client cooks him amazing food using a desiccator and uses a raw diet. And together we're helping Cody. Here's Cody at 13. Yay, Cody. This is my niece and nephews and their dog, Alma. Alma is a 2-year-old wonderful dog, and she's totally athletic. And Alma lives to eat and also to play and run. So Alma has no discretion around eating and will eat anything. This is her with her 2-year-old birthday treat. And about a couple of months later, I get a call from my brother and sister-in-law. There's something wrong with Alma. She's sitting and she's just kicking out her back legs and kicking all over, and she doesn't want to move. Her eyes are glazed. What's going on? And in talking them down or talking to them, I found out that the kids were feeding Alma walnuts along with yogurt and different scraps. My brother was also involved in this. Now, walnuts can be toxic to dogs, especially in large amounts. I didn't know if this was toxin related or just total indigestion, because her kicking out at the back legs are part of gas pain in the abdomen or pain in the abdomen that she's trying to get rid of. She also is coming into heat, so there could be pain or irritation from the uterus, just like women get before their period. Anyhow, what we did was we worked with Qigong energy, along with calling up poison control and having my family who live in Tennessee go on their way to the emergency clinic. In the meantime, we worked with energy along the conception vessel, the chest and the abdominal midline, working with points on the paws, on the front and hind paws, called the 4 gates, and also on the sides of the body with the gallbladder meridian and a spleen point, and offering the dog chamomile tea. Well, lo and behold, Alma moved out of it. So I was so happy that she didn't have to go to the emergency clinic. Thank you, complementary medicine and the energy field. This is Mr. Winslow, and Mr. Winslow is an older cat, actually the cat in the household with Watson. And Winslow has kidney issues, hypothyroid, chronic herpes in his eyes, and chronic nasal obstruction. So he's got a myriad of things, and my client loves him and does amazing things with him, including having practitioners like me over to do acupuncture and energy work. So Winslow was doing okay, and then he started to have blood pressure issues, probably from the kidney, and the practitioner used upping the thyroid medication to try to decrease the blood pressure. This did not work so well, and all of a sudden, Winslow was having issues as he was walking around. He would lose consciousness almost and fall over. When I saw Winslow, I felt that he was out of his body and that we needed to readjust the Western meds because he was not sustaining enough blood pressure for life. So we used acupuncture, and I sent him back to his regular vet to readjust the medication. And now Winslow is doing much better. This is me and Peppy. And she was a 14-year-old quarter horse who was with me for about 5 years. And she had metabolic issues, which means that she would overeat and create soreness in her feet and muscles and be sick. So we did a lot of work together, and here's me and Peppy doing energy work. And I want you to take a look at the picture and tell me who's doing energy work on whom. Definitely, we were part of the same energy field. Thank you, Peppy. And I wanted to end this little tour of my client stories, my patient stories, with introducing you to Lulu. And Lulu is 14 years old. She's a social butterfly, and she's all over the place. And Lulu, who belongs to my dear clients and friends, who's an avid hiker, started to not want to go on the trail. And she would just sit down and not move. My clients, who totally adore Lulu, did all kinds of diagnostics and wound up at the cardiologist, who told them that Lulu was having heart attacks and her heart was stopping. Lulu got a dog pacemaker put in. So Lulu is the first dog I know with a doggy pacemaker. And this was months ago, and Lulu responded wonderfully. Started, her energy was out on walks again until a few weeks ago when she started to not be so happy. And my clients then noticed that there was blood in the urine. So before taking her to their veterinarian for a whole urinary workup, which they will do, she wasn't showing any signs of a bladder infection. There was just blood in the urine. And I looked at Lulu and I just knew from looking at her that there was a circulatory issue. So Lulu runs around all the time and would be hard to sit still. And in Chinese medicine, there's a syndrome where when the heart is working overtime, that heat gets developed and the heat gets spilled over into other organ systems in the body. The end product can be issues with blood in the stool or blood in the urine. I felt this is what's going on with Lulu. So we did Qigong. And I didn't want to do acupuncture because with heart issues, things can get out of hand really fast. And I wanted to be as gentle as possible. So I felt Qigong was the way to go. And Lulu, who runs all over the place, literally sat at my feet while I did this. And I want to end showing you a video of the Qigong exercise that we use to calm Lulu's heart. Before showing you this, I want you to know that my clients during the whole thing finally realized that several weeks before they had brought Lulu to the cardiologist to readjust the pacemaker. And my feeling was that they upped the pacemaker too much. And that what basically happened was the pacemaker was creating too much heat in the heart, and that they would need to readjust the pacemaker to make Lulu comfortable. So here's the video. It's an exercise that Melissa Cranfield teaches called the heart is a rhythmic organ. And it goes like this, and you can do it with you bring your hands to the top of your head, feeling your shoulder blades, and you literally pump the fingers of your heart. Fingers of the hands, back and forth, like the heart is. This is the rhythm of the heart in your chakras. Then you go down to your chest in front of your heart, and you do the same thing. Remember to feel your shoulder blades. If you feel your shoulder blades, you're activating the back part of your arms, which is the small intestine meridian, and that's coupled with the heart. Then bring it down to your core, in front of your belly button, and your back is the meridian to the center, and you do the same thing. So thank you for your attention to this, everybody. And thank you for inviting me to do a presentation.